Again, the robot has made right donor kidney a possibility. The only person, in this case his son, may have a kidney with multiple arteries, which again in open surgery would be very difficult to do. Whereas in the robot it is very easy to do because the robot has 10 times the magnification. Imagine the best TV you have seen a cricket match, a 75 centimeter LED TV or a 100 centimeter projector. It is 4 times superior to the visuals that you get on the console of the robot. The third and the most important part is that everybody in the room can observe what is being done, as compared to open surgery only the surgeon knows what is being done. So the rest of the team members inside the operation theatre can help the surgeon perform optimally. So all of this has made what was a high risk open kidney transplant recipient surgery into a standard Saraga in Kannada, easy with excellent or brilliant outcomes, where 99% of the time the kidney works primarily, whereas it used to work about 70% of the time primarily in the open era. The only problem was cost from the robotic perspective, and the other major issue is skill. But again, typically in India, Apple phones are made in India, robots are made in India. I see the next 3 years, right now about 2% of the robotic surgery, of transplant surgeries are done robotically. But in the next 2 to 3 years, I see 1/2 of transplants being done robotically, even at government centers, because it is immensely superior in patient outcomes.
Knowing that we have a disease which is not easily curable with medication is one thing, but taking that leap of faith to actually come in and get a surgery done, and to have the love, the courage and the ability for the son to express all of that by donating to his father is something which is not easily to come by. So when such heroes come forward to undergo such a surgery, we as surgeons and with the nephrologist and the entire team of anesthesia have a bigger responsibility in giving them the best results with minimal or no complications, with a quicker discharge and return to normal healthy life.
So I would like to talk about the medical management of the renal transplantation, especially in the obesity patients. So starting with Mr. Dubey, when he presented to us in March 24, so he came with the symptoms of renal failure. So he was diagnosed to be having end-stage renal disease. There was no much options, so we had to force him to undergo dialysis. So that is, you can understand.
Prasad has spoken about the challenges they have faced. Very briefly, I will tell you as an anesthesiologist what challenges we face, not only with robotic surgery but also in obese patients. One of the biggest challenges of obesity is that it affects almost every organ system in the body, and we just, as anesthetists, we have to look at it from a holistic point of view and take into the considerations of every organ while planning the anesthetic management. The biggest challenge is, ensuring that their heart remains stable throughout the procedure. So the first challenge is, if you see on the right side, in a non-obese patient, putting in an IV line is so easy, you can see the veins so clearly, but this is a challenge in obese patients.
Transplant. Luckily I got one in Zimbabwe. He had been done kidney transplant here in India, but not at Fortis. He is the person who gave me courage to say, don't be afraid of anything. It's a straightforward process. So I discussed with my wife. The other kids also started volunteering. So there were so many of them now. So we had a problem on what to do. Then I said, no, let's first of all take the first one who volunteered. And then we go through the tests. If he passes the tests, then we proceed. So we did that. I've got a nephrologist in Zimbabwe. Through that nephrologist, tests were done, and the young man passed. And I kept on watching the young man, whether he was going to change his mind. But he looked very strong and dedicated. So at the end, I started communicating with the hospital to say, and I'm now ready. And then we arranged for my coming for the transplant. And here, it was done when we spent 2 months really doing paperwork, because I think it's proper. What happened was proper to really do thorough due diligence. And this was done, and all the paperwork was done with the help of the kidney transplant coordinators, Mr. Joshua and Mr. Razik. Then came the day on the 30th of October, the surgery was done.
ಕಿಡ್ನಿ ಕಸಿ ಶಸ್ತ್ರಚಿಕಿತ್ಸೆಯನ್ನು ನವೀನ ಆವಿಷ್ಕಾರವಾದ ರೋಬೋಟನ್ನು ಅಳವಡಿಸಿಕೊಂಡು ಮಾಡುವುದು ಒಂದು ಹೊಸ ರೀತಿಯ ಟೆಕ್ನಿಕ್ ಅಥವಾ ತರೀಕಾ. ಇದರಿಂದ ಕ್ಲಿಷ್ಟವಾದ ಕಿಡ್ನಿ ಕಸಿ ಶಸ್ತ್ರಚಿಕಿತ್ಸೆ ರೈಟ್ ಸೈಡ್ ಅಂದರೆ ಬಲಭಾಗದ ಕಿಡ್ನಿ ತೊಗೊಂಡಾಗಲಿ, ಸ್ಥೂಲಕಾಯದವರಾಗಲಿ, ಎರಡನೇ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ಆಗಲಿ, ನ್ಯೂರೋಜೆನಿಕ್ ಬ್ಲಾಡರ್, ಯಾರಲ್ಲಿ ಬ್ಲಾಡರ್ ಸರಿಯಾಗಿ ಯೂರಿನರಿ ಬ್ಲಾಡರ್ ಸರಿಯಾಗಿ ಮೂತ್ರಕೋಶ ಸರಿಯಾಗಿ ಕೆಲಸ ಮಾಡಲ್ಲ, ಅಂಥವರಲ್ಲೂ ಉತ್ತಮವಾದ ಔಟ್ಕಮ್ ಕೊಡೋದಕ್ಕೆ ಈ ಆವಿಷ್ಕಾರ ಸಹಾಯ ಮಾಡಿದೆ. ನನ್ನ ಹೆಸರು ಡಾಕ್ಟರ್ ಮೋಹನ್ ಕೇಶವಮೂರ್ತಿ. ನಾನು ಸೀನಿಯರ್ ಡೈರೆಕ್ಟರ್ ಯುರಾಲಜಿ, ಕಿಡ್ನಿ ಕಸಿ ಶಸ್ತ್ರಚಿಕಿತ್ಸೆ ಮತ್ತು ರೊಬಾಟಿಕ್ ಸರ್ಜರಿ, ಫೋರ್ಟಿಸ್ ಬೆಂಗಳೂರು. ನನ್ನ ಜೊತೆ ನನ್ನ ಕೊಲೀಗ್ಸ್ ಆದ ಡಾಕ್ಟರ್ ಶಾಕಿರ್ ತಬ್ರೆಸ್, ಅರಿವಳಿಕೆ ತಜ್ಞರಾದ ಡಾಕ್ಟರ್ ದತ್ತಾತ್ರೇಯ, ನೆಫ್ರಾಲಜಿಸ್ಟ್ ಆದ ಡಾಕ್ಟರ್ ರೇಣುಕಾ ಪ್ರಸಾದ್ ಹಾಗೂ ನನ್ನ ಕೊಲೀಗ್ ಆದ ಡಾಕ್ಟರ್ ಶ್ರೇಯಸ್ ಅವರಿದ್ದಾರೆ. ಈ ಒಂದು ಎಲ್ಲರೂ ಸೇರಿಕೊಂಡು ಜಿಂಬಾಬ್ವೆಯಿಂದ ಬಂದಿರುವ ಒಬ್ಬ ಕಿಡ್ನಿ ಕಸಿ ಶಸ್ತ್ರಚಿಕಿತ್ಸೆ ನೆಸೆಸಿಟಿ ಇದ್ದ ಪೇಷಂಟಿಗೆ ಅವರ ಮಗನ ಕಿಡ್ನಿನ ಲೆಪ್ರಾಸ್ಕೋಪಿಕ್ ಅಂದರೆ ಚಿಕ್ಕ ರಂಧ್ರದ ಶಸ್ತ್ರಚಿಕಿತ್ಸೆಯಲ್ಲಿ ತಗೊಂಡು ಅದನ್ನೇ ರೋಬೋಟನ್ನು ಅಳವಡಿಸಿಕೊಂಡು ಚಿಕ್ಕ ರಂಧ್ರದಲ್ಲಿ ಕಿಡ್ನಿ ಕಸಿ ಶಸ್ತ್ರಚಿಕಿತ್ಸೆಯನ್ನು ಸಕ್ಸಸ್ಫುಲ್ಲಾಗಿ ಮಾಡೋದಕ್ಕೆ ಅವಕಾಶ ಸಿಕ್ಕಿದೆ. ಈ ಒಂದು ಏನು ಹೊಸ ತರಹದ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ಪ್ರೊಸೀಜರ್ ಇದೆ, ಇದು ಫೋರ್ಟಿಸ್ ಹಾಸ್ಪಿಟಲ್ ವತಿಯಿಂದ ಕನಿಂಗ್ಹ್ಯಾಮ್ ರೋಡ್ ಬನ್ನರ್ಘಟ್ಟಲ್ಲಿ 2 ಕಡೆಯೂ ರೋಬೋಟ್ ಅಳವಡಿಸ್ಕೊಂಡು ಮಾಡೋದಕ್ಕೂ ಅವಕಾಶ ಇದೆ. ರೀಸನಬಲ್ ಆಗಿರುವ ಒಂದು ಮೊತ್ತದಲ್ಲಿ ಈ ಕ್ಲಿಷ್ಟವಾದ ಯಾವುದು ಶಸ್ತ್ರಚಿಕಿತ್ಸೆ ಕಿಡ್ನಿ ಕಸಿದಿದೆ ಎರಡು ಆಸ್ಪತ್ರೆಗಳಲ್ಲಿ ಮಾಡೋದಕ್ಕೆ ಫೋರ್ಟಿಸ್ ಹಾಸ್ಪಿಟಲ್ ಅವರು ಅಣಿ ಮಾಡಿ ಕೊಟ್ಟಿದ್ದಾರೆ. ಥ್ಯಾಂಕ್ಸ್ ಫಾರ್ ಲಿಸ್ನಿಂಗ್. ಥ್ಯಾಂಕ್ ಯು.